How does chemotherapy work? So, chemotherapy is often described as the backbone of cancer treatment, or one of the three pillars of cancer treatment, along with surgery and radiotherapy. And it simply means using drugs to treat cancer, but basically, when people talk about chemotherapy compared to other cancer drugs, chemotherapy is the family of drugs that work by attacking cancer cells during the cell cycle. So, the cell cycle is how cells reproduce, copy themselves. And you may remember from school it's got four stages. So, there's the stage one where the cells get bigger, and then stage two, the cell the DNA is copied inside the cell, and stage three, it's getting kind of a bit bigger and kind of preparing to divide, and stage four finally divides, and you have two cells. And the chemotherapy kind of disrupts this, interrupts this. There are many different kinds of chemotherapy and they work in different ways, but they disrupt the cell during the cell cycle. So they might contain, it might be an enzyme that maybe damages the DNA, so that when that part of the cell cycle happens, when the DNA is copied, the immune system recognizes it and destroys the cells. So chemotherapy can only attack cells in the cell cycle. And of course, as adults, most of our cells are sitting there living a full and fulfilling life, not dividing. So in that sense, maybe chemotherapy is great because it attacks those cancer cells that are dividing. Unfortunately, some of our cells are in the cell cycle a lot, and those are things that need to be replaced in the body. So that is things like hair, skin, lining of your gastrointestinal tract. So kind of from one end to the other of your gastrointestinal tract, like attacking the stomach lining, the lining of the intestines. I mean, that's getting replaced all the time. So chemotherapy, unfortunately, damages those cells, kills some of those cells, which is why with chemotherapy, maybe your hair falls out or hair stops growing. You often get a lot of skin issues. You often get a lot of gastrointestinal issues, so your constipation, diarrhea, that kind of thing, very unpleasant. Also, of course, children are growing, so the issues around using chemotherapy for kids. And for adults, wound healing involves growing new cells. You get a little cut on your leg maybe, and new blood vessels grow, kind of new capillaries, and new cells grow to repair the damage. And actually, in daily life, we get lots of tiny little injuries and we don't notice them at all. Generally, little issues heal up before we even notice, unless you're on chemotherapy, in which case scratches and bruises and things can just hang around for ages. It's very easy for things to get infected. Recently, when I was doing some chemotherapy, I had a little cut on the back of my foot, and yeah, usually it would have healed up before I'd even noticed. But after a few days, it was infected, and I had the kind of the burning heat from the infection, because the chemotherapy causes your your immune system gets weakened, gets suppressed, and the place where the body's trying to heal, chemotherapy is attacking that. So I had to treat it with topical antibiotics. It was fine, but it's just, yeah, one of those annoying things about having chemotherapy. So yeah, that's really how chemotherapy works. Chemotherapy is typically not considered a cure for cancer. It's very unusual for chemotherapy to be able to cure cancer just by itself. In combination with other treatments with early stage cancer, sometimes that treatment can be curative. Chemotherapy will often be used maybe after surgery to hopefully get rid of any cancer cells that escaped from the surgery or that were missed by the surgeon. Surgeons can only get tumours that are sort of down to maybe a couple of millimeters. So a 1 millimeter tumour could still contain huge numbers of cancer cells and be a cause of recurrence. For late stage cancer, chemotherapy seems to be considerably less effective than early stage cancer. And one theory of why that is that there may be cancer stem cells, or sometimes called like cancer cells with stem cell-like properties. These are cancer cells that are not engaging in the cell cycle most of the time. So they're kind of lying there dormant, and at some point they maybe break free and cause a tumor somewhere else, or they cause the tumor where they're situated to grow. So chemotherapy is not able to get cells that are not in the cell cycle. So that's an issue. So stem cells seem to be highly resistant to chemotherapy. And unfortunately, if there are late stage cancer, you often have big tumours, several tumours. It's a lot of cancer cells, and some of them are going to be naturally resistant to chemotherapy. And they're going to survive the chemotherapy, and they're going to cause growth, spreading of cancer. That's another reason why chemotherapy is not a particularly effective treatment for late stage cancer, unfortunately. I've had a lot of chemotherapy. I'm not particularly a fan, although undoubtedly it's helped to save my life. The side effects are severe, and it's not hugely effective for late stage cancers, which is why you often hear it being said that chemotherapy is not a cure for cancer. But I do want to make it clear that in combination with other treatments, it can be part of a curative treatment. Please post a comment with anything that was useful in this video or any questions you have. Thanks a lot.